Hey guys, I'm just waiting for our guest speaker. Let's. So today's topic is about more about mental health and such. So I think today will be well informative and fun. So hi Cauviya.
Yeah, hi, Priya. How
Hi.
are you?
Yeah, I'm good. I'm sorry. I think you were expecting Anupriya, but instead
Yeah,
she
yeah,
got
no.
she
Yeah,
got stuck with an emergency. So I will take over for her. Okay. So yeah, so for everyone who is here, so we are started our life. So today's topic is on PCOS and mental health, and we have our own psychologist who is a trauma-informed relationship and personal counselor, and internationally accredited art therapist, which I'm very personally favorite for, and certified suicide prevention gatekeeper, and also the founder of Cancer Project. So welcome, Kavya.
thank you.
Yeah. So yes, let's get into the topic today. So PCOS and mental health. So as far as we know, PCOS is such one of the medical conditions. So where the women have cyst in their ovaries. So how it's related to mental health? So how is it? What are the psychological impacts for women having PCOS?
Okay, so first of all, PCOS is the endocrine disorder where, it's basically it's a messed up hormones like hormones are haywire. Generally, even without PCOS, when the women are going during their menstrual cycle, the hormones are spiking up and it's getting lowered and things are happening. But when it comes to PCOS, it is all even more intensified. So naturally, when all these things are happening inside your body, there will be some level of exhaustion. Exhaustion as in even physical fatigue for that matter. So when that
Mhm.
happens, we are naturally going to feel irritable. Irritability as in like how do I say? Even if someone is trying to talk me, I'll be like, oh my god, don't talk to me. Like I'm already so irritated with everything happening. But when somebody is trying to talk to me, so it is perceived as anger issues. Like
Mhm.
even though
Mhm.
I'm not angry towards that person, I'm just irritable for that
Okay.
moment. It is perceived as anger issues and everything else. Like and the stress, the amount of stress the body is going through. It
Mhm.
is naturally again when you are going through something physically, the cortisol levels are spiking up as well. Cortisol is a stress hormone, which is naturally going to lead to it is going to mess up with your insulin levels. And we know when it comes to
Yeah.
PCOS, it is all even more worse.
Mhm. Yeah, it's all
So that's how
interlinked.
it is. It's very much interlinked. Like m- mental health is always physical. Like even for instance, when you take anxiety, how do you define your anxiety? You define your anxiety with palpitation. Palpitation is increasing your heartbeat. So how is that
Yeah,
not physical? Like how is mental health is always related with physical health.
yeah, yeah, I think. So yeah, that's how the anxiety gets in related with the PCOS as
Yeah,
such. So I guess yeah, that's there.
yeah,
So next, the next thing is when people have PCOS, there were other physical symptoms as such, the acne, the dark patches around their body, and also facial hairs.
yeah.
Most of them we
Yeah.
can say that is normal to have a facial hair, normal to have acne, but still it causes such insecurities, and people still cover
Yes.
themselves. So how can people, come over that, saying that it's okay to have all that, and at the same time taking treatment for their hormonal imbalance too? So it's pretty much
Yeah.
contradictory in themselves, but still, people should take care of themselves when it comes to because of a medical condition.
Yeah, so when naturally we know, right? Like PCOS itself has some physical, the body image gets changed.
Yeah.
We naturally get body image issues. Body image issues is going to give you so low self-esteem, and low self-esteem is going to give you depression. I mean, it's all interlinked.
Yeah.
So, how do we deal with this body image issues? First thing, people should stop commenting about people's body, and I don't think it's possible, but we can try.
And that's
Instead
not
of
at all possible.
yeah, when they start commenting, like even if there is nothing wrong in your face or in your the way your hair looks, when somebody even in their micro expression we can see why do they look at me like that? Like that itself, even they are not even commenting, that
Mhm.
expression will put you off. So
Yes.
so maybe we should start becoming more kind towards each other. I mean, on a general level. So,
Yeah.
so
Yeah, that's
body
the
image
point.
issues, body image issues is leading to some other eating disorders as well. Eating disorders are mental health illnesses. Like it's an illness as such.
Mhm.
So people don't realize that. People start training themselves, trying various unhealthy methods to cope. Like,
Mhm.
like to reduce your weight, there are so many healthy ways to do. But what do? We don't do. We starve, and that's leading you to a lot of deficiencies and other stuff. And again, we overwork in the gym. Like you
Yeah.
exhaust yourself physically. That is again, the obsession towards body image. Like I have to look in a certain way. I have to weigh this much. Like my weight matters a lot. That the number matters a lot, and even the size of your jeans matters a lot. So
Yeah.
that's when you should start looking at the way instead the way we live shouldn't be so stressful. It should be easy. Like, but people make
It
it
should.
so hard for us. Yeah.
Yeah,
So
it's
how do
complicated
we
in
deal
such
that?
way.
Is we can take yeah. How do we? Okay, I think there is a lag in the internet.
Yeah. Okay. Okay. I think you can carry on. Can carry on.
Yeah, I mean, for that, even to understand what we are going through, sometimes we don't know what we are going through, right? Like,
Mhm.
maybe I think I am stressed. Stress is a very, very generic word. We can't put it under, it is a very big umbrella term. Why are you stressed is a different, people might be depressed or anxious, or they could be going through something else and they will call it as stress.
Mhm.
And so many, even your physical body will be telling you something. This is what is happening inside you. But instead
Mhm.
of listening to that, we just think it is because of stress I'm feeling this way. That's all. So stress is a very umbrella term. Maybe we should get closer to it and listen to what is happening inside our body. Taking mental health help,
Yeah.
you know.
Yeah. Instead of
So
just
that's how.
categorize
That's the
as
first step.
stress. Yeah. So yeah, as you said, people randomly follow the internet advices on food, and also the obsessive training, physical training, which is, they need a physical or professional help instead of randomly get into the disorder, and they in further long term they will get into eating disorder as such. So yes, and for all this you need a professional guidance, and in terms of lots of opinions and unsolicited advice or dumped in social media, and instead of going and choosing that, I think you should go for the professional guidance. So yes,
Yes.
that's also
Yes.
another point on that. So next question
I
is.
mean, it makes a lot of. It makes a lot of difference, right? Like when
Mhm.
a friend is advising me, it is different. And but when a
Yeah.
professional is going to, it could be the same point repeated by a professional, but that will have a different perspective.
Mhm. Yeah,
So
there's a lot of
yeah, I
trust
mean,
comes.
seeking
Yeah.
help is not a weakness.
Yeah,
Yeah,
of
it
course.
takes a lot of courage to ask for help.
Yeah, and I think advice from a professional gains more interest and gains more trust because they know what they are saying and they have evidence too. So I think that's a very good and right path. So next,
Yes.
we'll move on to the next questions. So if the hormonal imbalance prolonged for a long time, is there a lead to any psychological disorders as such, like eating disorder as you
Yes, of
said, or
course. Yeah. Eating disorder is very much directly linked with
hmm
PCOS and other endocrine disorders.
hmm
And of course, it is going to depression is pretty much a mental illness, major
yeah.
depressive disorder. Yeah, and also there are evidences which says people, women with PCOS have tend to get bipolar disorder.
Okay.
I mean, studies say that. Yeah. So
Actually, when we talk about depression, so usually everyone now these days are calling out, I have a depression, don't talk to me, I need some
yeah,
time alone. So, but it is a clinical condition where if you get upset over something, that's not a depression. Depression is a clinical,
yeah,
yeah. So can you tell more about what is depression and what is not depression?
yeah. So depression is a term which is very much interchanged with everyday life sadness or whatever it is. So first of all, depression is not equivalent to sadness. If you are sad, it's just sad. It's not.
Yeah,
Depression means there is a dip in your energy level, mental energy level. Like you feel exhausted all the time. You don't feel like doing anything. That energy level is the major factor in depression. When you don't have energy, naturally you will not have any interest to do things. You will not have the energy to socialize. You will not have the energy to eat. You will not have the energy to do anything. So these are the symptoms of depression, right? Like you don't socialize. You are not interested in the things you used to be interested. Generally, we list certain things, right? If you narrow down, you can see that it's basically because of, energy level. Like in Tamil, we say the literal translation of depression in Tamil is manasorvu. It is not sogam. It is sorvu. Sorvu is tiredness.
okay, okay.
So it is. So we have physical energy. Likewise, we have mental energy. So how can we improve our mental energy is what we should think about. So
Yes.
when you have PCOS, you start ruminating about things. You keep overthinking about things, right? Like I look this way. Nobody is going to like me. We start thinking certain things, and it keeps ruminating, and overthinking gets into a spiral, and so yeah, so things like that happen. So when you are thinking constantly, there is no rest for your mind. You are thinking, so naturally your mental energy will be depleted. You will feel
Yeah.
exhausted.
Yeah, that's true. And also, people made it so normalized being depressed in the social medias. I'm depressed and making memes out of it instead of, working on that, instead of coming out of that, they kind of basically normalized it. And I
Yeah.
think, you should reach out to professional. You need some guide and help, guys. So yeah,
Yeah,
please.
I mean these things, right? Like not just depression. Like food is my therapy. Memes are my therapy. These are my love language. Oh, all these things are extremely interchange, and it doesn't make
Yeah.
sense at all. That is not your therapy. And
Yes.
it can be therapeutic, but it is not therapy.
Therapy, yeah. Yeah, who needs therapy? You have your best friend kind of thing.
Yeah.
Yeah, that's kind of a memes revolving around as such.
Yeah.
So yes, so can other than there's a depression and anxiety, and apart from that, people need to follow certain lifestyle changes in order to manage PCOS. So the lifestyle changes, which also includes apart from nutrition and exercises, they also need to manage stress. So there's a lot of treatments and techniques and therapies. So how come the art therapy can help them, improve or manage the stress?
Okay, so art therapy is basically, I use art therapy for emotional regulation. So emotional regulation is something, see, every problem arises from that particular, it is a root, it is the source of everything. Like when you are emotionally dysregulated, every other
Mm-hmm.
problem comes in. So to regulate your emotion, you can use the art. Art as in, like it is a form of outlet for you. Like, for example, something has happened and I'm feeling upset about it, but I cannot talk about it to anyone because of various reasons. I can draw something, I can scribble something. I don't even have to draw. I can scribble. That itself will give you some, you know, that will help you.
Yeah.
So art therapy is not just, you don't have to be an artist to take art therapy.
Mhm.
Uh, if you know to use a pencil, that's more than enough. And you can start scribbling whatever you feel like. Like you can start drawing lines, dots, however your anxiety feels like. For example, I mean, if you're doing it for anxiety, how does your anxiety feel in your body? Like you can draw dots, you can draw spirals, you can draw, waves or whatever it is. So that's how you express it. And when you do that on paper, it's coming out of your body. That's all. So that's how it is going to. So emotional regulation is something which you have to do on daily basis. Like for example, someone is yelling at me, but it's not my fault, but they are yelling at me. I am
Okay.
not in the position to talk back. So
Okay.
what do? I just keep it with myself. I keep it with myself, and I am moving on because I have a lot of other things to do. So what happens to this anger or sadness which I am feeling? It is getting suppressed there. It's not going to evaporate over a time, but it is still going to be there inside me. But I am moving on with my life. So it is one particular incident. But like this, there are multiple incidents which are happening in our life, and we are not processing those things. So that is when emotional regulation, art therapy comes in. Like you regulate your emotions, you organize it in a particular way
Mhm.
so that even see it is not going to if you are having grief, anger, name whatever the emotions, it's all messed up. Art therapy will put it in a box. That's all. It's not going to take it away, but it is going to put it in the box, and with the help of therapy we can work on
Yeah, yeah. I think
it.
that's right
So
because
when people with PCOS, there are so much of hormonal imbalances and so much of emotions going on. Their emotions will be extremely dysregulated.
yeah,
So to
yeah, I think yes.
straight it up, we can use them.
Yeah, they go through a lot of opinions and they kind of bottling up their emotions
Yeah,
as
yeah.
well. And yes, and I think art therapy would help that open up and pour all those bottled emotions in that bottles, I guess. So
Yeah,
yes,
even if
and
I don't remember the things which happened 10 years ago, 20 years ago, I don't remember. I don't know
Mhm.
what my maths teacher told me in my fifth standard.
Mhm.
But I would have felt bad at that time. But it's still
Yeah,
there. So art therapy will help that.
yeah, it's bringing back all those things.
Yeah.
Yeah. So
Okay.
yeah. So these managing the lifestyle changes or managing or coping up with the stress also needs some kind of motivation, right? So I want to do this. I want to make myself feel good. So for that motivation, I think most of the women who's facing hormonal imbalance find hard to get that motivation. And whatever I explain, people will get always feel that low energy, and it's very hard to
Yeah.
motivate them. So is there any
Yeah.
opinions that you can give me, to motivate people so you can work on yourself
I
to do
mean,
better at that?
motivate people to, follow a routine kind of thing.
Not a routine, to help them understand that you work on this so that you will make, you will feel better like that.
Okay. I mean, it's like you are doing this for yourself. It's kind of like that. No, I don't understand the question.
Yeah, it's for everyone. Everyone at some point lose their motivation. So yeah, I would like some tips
Oh, you
to.
want, okay, to stay motivated always.
Yeah,
Okay.
obviously.
Okay. So maybe, see, the motivation can be of two types, internal and external. External
Okay.
motivation, like I am coming and hyping you up, you are doing good and cheering you up, and that's that is again motivation, but it's not going to last for a very long time.
Mhm. Yeah.
So we have to stay internally motivated. How do we do that? So to stay internally motivated, you have to feel some kind of, again, colloquially speaking, self-love,
Okay.
or psychologically speaking, unconditional positive regard. Uh,
Okay.
so unconditional positive regard for yourself, like even today. So I cannot do this thing because I'm feeling so exhausted. Instead of beating myself up, instead of blaming, feeling guilty for not doing it, uh,
Mhm.
like we generally feel like in the routine kuda panna mudiyala, like that. We start guilting ourselves. So instead of
Yeah.
doing that, maybe we can cut some slack. Like this is what has happened. So this is why I'm feeling this way. So
Mhm.
I'll do that. But it shouldn't go the other way also. Like
Yeah.
cutting so much of slack for yourself.
Yeah, that happens to
So
a lot.
yeah. So when you feel when you are doing something, that's why we have to stay in touch with our element. Element as in something you like to do. For example, if I'm an artist, I might like to paint. So if I'm
Mhm.
a guitarist, I have to guitarist as in my passion for guitar. So
Mhm.
something you like to do, you have to stay in touch with that. So when you
Mhm.
do that, it's kind of giving you a sense of accomplishment. So when you
Yeah.
feel like you have accomplished something, it is again going to motivate you. Like, okay, so I have done this, so I am capable of doing so many other things also. So that sense of accomplishment will give you the momentum to do many other things.
Yeah. Yeah. That's great. So,
I
for
don't know if
people,
I'm answering you.
that's okay. That's okay. Sorry for
Yeah.
that. So, for PCOS, the lifestyle, there are a lot of treatment. So, what do you suggest and what do you think is the best treatment, or this treatment should beneficial for them?
Okay. You're putting me in the spot. Okay. So, so I mean, I'd always say it's not just physical or mental health.
Mhm.
There is no such thing as this is the best thing to do. No. It might work for me, it might not work for
Yeah.
me. That doesn't mean that
Right.
treatment is the trash. Yeah.
Mm-hmm.
So maybe we should start testing everything and see what. See, if
Mm-hmm.
yoga is working for me and weights are helping you, that doesn't
Mm-hmm.
mean yoga is a, you
Yeah.
know, is not in a healthy way or something like that. So again, instead of just giving the hormonal treatment, like look through the
Mm-hmm.
gynecologist medication, maybe we should start trying in a holistic way, like nutrition, mental health, and other stuff also. Like collectively, only it is going to give you some effect.
Yeah.
Not one particular. There is no magic pill. Like if you do this,
Yeah.
you will be all right. No.
Exactly,
Okay.
exactly. Thank you so much for clearing that out, because what works for you may not works for others, and what works for us may not works for you. So this is what you need and what your body requires. So based on that, you
Yeah.
should take steps and look for the management techniques as such. So the next thing is, and as such, as we're talking about, there are a lot of psychological disorders leading up to it, which includes eating disorders and
Yeah.
depression, anxiety, as such. So to combat all that, there are a lot of other techniques, like in except other than art therapies. So what are the other techniques that people should look up to, and how about how to reach to the psychologist or psychiatrist to resolve all that?
Okay. Okay, maybe I'll just clarify who's psychiatrist, who's psychologist first. Because psychiatrist is a doctor, like
Mhm.
they complete their MBBS and they complete
Mhm.
their masters in psychiatry and they become a doctor.
Mhm.
Whereas psychologists are not doctors; they are,
Mhm.
they do BSc, MSc, PhD, kind of like that. So a psychologist or someone who can provide therapy, uh, who can diagnose they can screen the test but they cannot diagnose what is happening. So
Mhm.
a psychiatrist can provide medication, the psychologist cannot give medication. So that's how it is. So that is a different
Like,
major difference between psychiatrist and a psychologist. So whom to approach when I am feeling depressed or when I'm going through something is, maybe at first you can reach out to a clinical psychologist.
mhm.
Clinical psychologist, something who will be assisting or even work independently on their own. Like they might screen. Like for example, I'm scared I might have ADHD. So
Mhm.
where do I go? I can go to a clinical psychologist and get screened. Like this is what is happening. Like so, if they say yes, this looks like ADHD, next I will be going to psychiatrist and get some help through
Mhm.
medication or whatever the reason. But it is not going to stop there. If you take medication, will my ADHD go away? No, it's not going to go away. You have to come back to counseling psychologist or psychotherapist, whoever. You have to take, long-term therapy
Mhm. So it's based on people actually.
based on the your requirement, what
Mhm.
diagnosis.
Yeah.
So if you don't have any mental illness as such, like who do like I don't have depression, I don't have anxiety, I don't have ADHD, so I still feel like a mess at times. So where do I go? I go to a counseling psychologist or a therapist, like who will talk to me, who will make me understand, who will give me new perspectives about life. So a therapist is someone who's going to help you with different methods. Like for example, if I'm thinking in a wrong pattern, they will help me. This is what is happening. You can start thinking, looking at this in a different way, kind of like that. So
Yes.
for normal people, like I have personal problem or family problem or other couple counseling, all
Yeah.
this can happen in normal therapy. Yeah.
Yeah, I think that's awesome because people actually there's a lot of hesitant, reaching up for psychologists in the first place. And after that, once
Yeah.
they get to know the actual need for that, they will reach for that and they will start, understand the purpose or such. So, and
Yeah.
if you have anything to add on, how to combat the PCOS struggles for women, you can add.
Okay. Yeah. So PCOS has been a very nowadays it is very prevalent. Like most people have PCOS and they don't really care about it until they want to procreate.
Yeah, exactly.
Until they want a baby, they just ignore it. Like they
Mm-hmm.
don't even consider it as a problem. Like I have seen people they don't get periods for like 7 months, 8 months, and they don't care about it. They are like, just like that. And once they get married and they want to procreate. At that time they will be struggling. Like this is what is happening and things like this. So instead of waiting,
Yeah.
waiting for it to get severe and it is making you take treatment, we can reach out in a very earlier state itself. It could be
Yeah.
even more easier, right, to manage it.
Yeah. Actually, we should be told like there should be an awareness on people. You should take care of your menstrual as such. If your periods are not in a regular phase, you should consult a doctor or any help you can get. So actually, we don't, as a teenager or as a young adults, we don't have that much of an awareness so that you should reach for help if there is lack in your menstruation as such. So I think people should know about that if there is any abnormal menstruation or if there is any irregular periods, you should seek for any medical guidance. So yes, and that's that.
Yeah.
And after that, instead of like as you said, instead of going to gynecologist to only when you want to get a pregnancy as such. So I think
Yeah.
prevention is better than cure.
Yeah. I
So
mean,
yes,
even after it is, I mean, even after you're getting PCOS, they don't reach out. Like they wait for the last one becomes
Mhm.
severe, and then why do we have to complicate things?
Mhm. Yeah.
So I just want to tell one more thing. It is
Yeah,
out.
yeah,
It is
sure.
nothing relevant to PCOS. I just
Mhm.
want to tell that uh, men should start learning about women's reproductive health.
Yeah, sure, sure. Because
Why
in
is
most
that?
of our family household, the men are the decision makers, and men is the one who revolve around men. And I think, yeah, men should be aware instead of neglecting that's a woman's problem as such. I think they should too. Yeah.
Yeah, because when I have seen people who are who want to take treatment for PCOS, but they are not financially independent. They are dependent on their husband or father, but they are not allowed to take treatment. So it is kind
Yeah.
of complicating their wellness.
Yeah. That's the
Yeah,
case. And I think we got one question. Can PCOD patients able to get pregnant?
yeah, of course. PCOS is reversible. They can get pregnant.
Yeah, of course. So PCOD is very vague conditions, and you can get pregnant if you follow certain management techniques, and you can control all such symptoms if you follow management techniques. So once you controlled all the symptoms,
It's
it is
a
very much
it's
possible to get pregnant.
I mean it's a
Yeah, yeah,
lifestyle disorder. So if you change your
yeah,
lifestyle, it is reversible.
yeah, of course. So is there any questions that you want to ask, guys and girls?
We, we have 4 people. Okay,
So yeah,
I just want to say hi to Merlina. Merlina said
yeah,
friend
Merlina.
and junior.
Yeah, you are her junior.
No, you are. I am a friend.
Yeah. Oh, okay, okay. Yeah, yeah, I am her junior.
Yeah.
Yeah. So I think that's
Okay.
it. So yeah, thank you, Kavya. Thank you for coming here,
Thank
and
you.
thank you for explaining, and thank you for mentioning that men should also, look after women for their health. So yes, guys, take care of us. So
Because it
yes,
is also
thank you.
complicating their life, right?
Yeah, of course. Yes.
Okay.
Okay. Thank you, Kavya Madeline. It's very nice evening with you.
Yeah. Yeah. Thank you. Thank you
Okay.
for having me.
Yeah. Sure.
Bye.